Beth Faiman is a nurse practitioner from the Cleveland Clinic who's also pursuing a PhD. We're happy to have her with us here on Oncology.TV at 2013 ASH in New Orleans. Beth, thank you.
Okay.
So you're working in multiple myeloma. Why this field?
Multiple myeloma is a cancer of the bone marrow plasma cells, and it's just unfortunately not very well understood by many. And I've been working with the patient population since the mid-1990s, and I fell in love with the idea of taking care of the patients and the fact that they're living longer. So my goal is, of course, to find new strategies to treat the myeloma, but really to enhance the supportive care. Patients are living longer than ever, and we just don't have very good supportive care strategies to prevent them from having infections and develop symptoms such as peripheral neuropathy, which can be, even mild neuropathy can be very devastating to the patient and their family.
What research do you have being presented here at ASH?
I do have research that's presented here at ASH, and I have research that's ongoing, which I'll be sharing with hopefully at ASH in 2014. The one research paper that our colleagues had presented was an abstract to evaluate subcutaneous Velcade. So Velcade is a proteasome inhibitor and is notorious for causing peripheral neuropathy symptoms in patients with multiple myeloma. Recently, it was described by Moreau and colleagues that the dosing of bortezomib or Velcade in subcutaneous fashion can decrease neuropathy. We at the Cleveland Clinic since 2010 have been giving Velcade subcutaneously. So what we did is we looked at all of our patients with multiple myeloma and amyloidosis who've had Velcade, and we looked to see if there were any confounding variables such as diabetes or other conditions to contribute to neuropathy, and to see how long they were able to stay on therapy. And what we found is that when patients received Velcade subcutaneous, they were able to stay on therapy longer, but about a third of the patients still required dose reduction. So while it helped them stay on the therapy longer, the Velcade, we also noticed that we had to still dose reduce for neuropathy as a toxicity.
The Cleveland Clinic uses a multidisciplinary approach in treating multiple myeloma patients. You're really part of quite a team, aren't you?
The Cleveland Clinic is one of many institutions that use a multidisciplinary approach. So there is a team at the Cleveland Clinic that I am a part of as the advanced practice nurse and nurse researcher. We have nurses, physicians, and we also call on our orthopedics and nephrologists because multiple myeloma can attack the bones, the kidneys, and develop anemia. And so we really call on all of our specialists, and we have a team of doctors that will help support the patients through at the diagnosis and throughout.
What do you see as the future role of advanced practice nursing?
The role of advanced practice nursing is continually evolving. I have been a nurse practitioner since 2002, and as I mentioned, I will obtain my PhD hopefully this spring of 2014. And I find that with the Institute of Medicine's initiative to maximize our scope and have us practice at the scope, at the top of our scope, I should say, I really feel like the advanced practice nurse, the physician assistant, is really going to be integral into the diagnosis and management even more so than we are now. And really, the advanced practice nurse provider will have more of a voice into the patient and the diagnosis and the treatment and the management.
What journals are there for advanced practice nursing?
There are journals for advanced practice nurses, and one of the ones that I've been published in, I've been fortunate to be published in, it's a peer-reviewed journal, and it's the Journal of Advanced Practitioner in Oncology, or JADPRO. And JADPRO really tailors to the scientific needs of the community and really enhances the overall nursing and symptom management needs as well. And it's not just hematologic oncology, it is solid tumor oncology, and there's a host of articles from translating research into practice articles to peer-reviewed journal articles.
Thank you, Beth. Beth Faiman, nurse practitioner from Cleveland Clinic, joining us here at ASH 2013 on Oncology.TV.